Doctor, are you duly licensed to practice psychiatry in the state of New York? Yes, I am. Now, tell us about supportive psychotherapy. Well, therapeutic efforts directed toward a strengthening of the patient's ego in order to reduce anxiety might define supportive psychotherapy. And what is the real problem? The real problem that remains unsolved and may become acute again at a crucial moment is, just a moment, doctor, what is transference? Transference is a patient's unconscious reaction to a psychiatrist, which is a repetition of an early childhood relationship to a parent, sibling, or other. The psychiatrist utilizes the transfer situation to gain insight into the patient's disturbing emotional conflicts and to plan his psychotherapy accordingly. Doctor, what are the terms related to psychotherapy? Well, I think you are referring in this document to psychopharmacology. Yes, psychopharmacology, that is correct. Well, that refers to drugs, anti-anxiety agents, drugs which exhibit a central calming effect. Are they used, doctor, in the treatment of mild to moderate anxiety? Yes, they are. These antidepressants, so-called psychic energizers, which relieve dependency, tension, fatigue, and mental depression, as well as syncope, are very important. Doctor, what are the antipsychotic agents? The antipsychotic agents are drugs used in treating psychoses and controlling excitation of the central nervous system. Doctor, what are antiractics? Antiractics are tranquilizing agents widely used in psychiatric disorders such as agitation, aggressive outbursts, psychomotor or psychomotor overactivity, and the like. Doctor, are they the same as anti-anxiety agents? Yes, they are. What are hallucinogens? Hallucinogens are chemical agents producing hallucinations, disturbed thought processes, and depersonalization in normal persons. Doctor, is that like a psychedelic? Well, psychedelics are drugs which apparently expand consciousness and enlarge vision. And psychopharmacology, doctor? That is the science dealing with drugs that affect the emotions. What are psychotogens? They are drugs producing psychotic behavior. Doctor, let me get into the symptomatic terms. Yes. What are they? Well, there is aggression, which is a forceful, self-assertive, attacking action, verbal, physical, or symbolic. And doctor, the agitation is what? Agitation is chronic restlessness, important psychomotor reaction of emotional stress. And ambivalence, doctor? Ambivalence is opposing drives or emotions, for example, love and hatred for the same person. Doctor, what is amnesia? Amnesia is a loss of memory, pathological in nature. And anaclitic? Anaclitic is leaning on. It refers to dependence of an infant or mother, abnormal later in life. Doctor, what is autism? Autism is a form of thinking which seeks to satisfy unfulfilled desires but completely disregards reality factors. And blocking, doctor? Blocking is a sudden interruption in the stream of thought. Doctor, what about body image? Body image is the conscious and unconscious picture a person has of his own body at any moment. The conscious and unconscious images may differ from each other. Doctor, what is catalepsy? Catalepsy is diminished responsiveness, usually characterized by trance-like states. It may occur in organic or psychological disorders or under hypnosis. And catharsis, doctor? A catharsis is a wholesome emotional release by talking about one's problems or repressed feelings. And what about circumstantiality? Circumstantiality is the inclusion of numerous details in conversation before the essential idea is expressed. Doctor, confabulation? Confabulation means the more or less conscious or unconscious defensive filling in of actual memory gaps by imaginary experiences, often complex, that are recounted in a detailed and plausible way when principally in organic psychotic disorders. That is confabulation.
That was good.
Edward Conscious.